Well, health experts are learning new things about COVID all the time. We know it can cause fever, cough, body aches, loss of taste and smell. But did you know the virus can also lead to rashes? And here to talk about the symptoms to watch out for and treatments is dermatologist Dr. Glynis Ablon with the Ablon Skin Institute. Doctor, thank you for joining us this morning. We appreciate it.
Of course. Thank you for having me.
All right, so dermatologists around the world, they've been noticing a possible link between COVID and skin rashes. There's some new research. Can you share that with us?
Of course. So in January, there was a publication in the British Journal of Dermatology, and the authors discussed the diagnostic value of skin manifestations in COVID. And they looked at over 300,000 individuals on this COVID symptom study app. And it was believed early on that rashes were uncommon, but the hospital data shows now that about 20% of patients with infection actually have cutaneous or skin manifestations. There are two rashes that are considered to be more specific patterns of COVID, and that includes a vesicular rash, which are small vesicles usually on the trunk. They can also be found, though, on the extremities and head, which tend to be itchy and lasting about 8 to 10 days, and signifying more moderate disease. There's also the acral rash, which is seen on the fingers and toes, known as pseudochilblains, or covetos as people know of it. And then there is the morbilliform rash, which tends to be, that's called measles-like is what that means. And it's a maculopapular rash, which are small, raised and flat lesions. And then an urticarial rash, which are basically itchy welts that usually occur on the trunk lasting about a week. And both of those two are tied to more severe disease. In children with COVID, we're actually seeing more redness on the palms and soles, as well as erythema and redness around the eyes and mouth, and even strawberry tongue, which is associated with Kawasaki's in the past. And this is more, again, with severe disease. And in the elderly, we actually have a livedoid rash or retiform purpura, which are these violaceous patches, which signify vessel damage in severely ill patients. We're now also learning more about oral exanthems, which are rashes and erosions in the mouth that can be associated with COVID. And partly we think this is because in the past, personnel were oftentimes uncomfortable removing the mask from a COVID-positive patient.
It's so interesting that there's different symptoms for different age groups out there. Can you talk to us about the treatment options that are out there? And is it kind of one size fits all for everybody, or are there different treatment options?
You know, treatment really is, with these viral exanthems, it's really supportive and symptomatic. So we have antihistamines and topical corticosteroids for itching and inflammation. Oatmeal baths will help with, soreness and calming the skin. Dumbro, which is a soaking aluminum hydroxide, will actually dry out the blisters or vesicles. And then there's a controversy whether or not to use aspirin or ibuprofen in these circumstances. True embolic events really do require more extensive treatment. So really, again, it is kind of palliative care.
Got it. Got it. And can you talk to us about coveto? Can you explain what exactly it means and what can be done about it?
Yes. So this is called pseudochilblains or pernio-like lesions. True chilblains or pernio is actually a reaction, an inflammatory skin disorder that is seen with sub-freezing damp environments. But in this case, actually seen with COVID infections, it's actually a late manifestation of the condition, and it is a resolution phase of the infection and actually seen with signifying a milder course. So it's actually a good thing if you're going to have a rash. And there are other vasculopathic lesions that are actually more severe and things that really need to be have more of a workup.
All right. Well, doctor, thank you for sharing that new research with us, what to look out for and the treatments. We appreciate it.
Of course. Thank you for having me.
All right, for more from Dr. Ablon at her Skin Institute and Research Center, head to the website. It is abloninstitute.com.